see where I was.
And then the environment was cleaned up.
I was hearing about this stuff. Wow. It was totally new to me. With social impact consulting. Hello everyone, my name is Efwa Elens Ede with Social Impact Consulting. I'm a development consultant with 20 years of experience working with NGOs, international NGOs, and bilateral agencies to work in project support, monitoring and evaluation, and civil society strengthening. So now, I saw that local NGOs lack the capacity to manage large-scale projects, which can in turn impact their various communities because they have the connection based on their backgrounds. So this made me create this channel so that I can add value to you for free once you subscribe to this channel and get notified of upcoming videos. I look forward to hearing from you. Hello, everyone. Good afternoon. Welcome to another wonderful episode of the Development Sector Series, which is Dev Sector Series. This is Efwa here coming to you live Wednesday at 12 noon. So once you get here, make sure you let me know where you're hailing from so that I can thank you personally for coming. Thank you all so much. As you all know, and if you guys don't know yet, Leap Africa is 20 years old, so over 2 decades of impact, okay? So that's really exciting. So Dev Sector Series decided to work with Leap Africa to now talk to young social innovators because they have a social innovation program. And I think I was like I said to you a couple of weeks ago, I was interviewing Femi Taiwo for the upcoming documentary, which I just shared with you a little snippet. Is he began to share with me about the Social Innovators program, and I said this is just in sync with what I'm working with on the Development Sector Series, which is sharing how people are changing the world, how people are maximizing social impact. So I'm really, really excited about this guest, because he is young and he just decided he saw a need as a doctor and just decided to meet this need. As you know, Nigeria has indices when it comes to maternal and child health is dismal, is nothing to write home about. You can compare us with war-torn nations when it comes to those indices. So it was not, this person that I'm going to introduce to you all didn't just sit around and say, oh, this is such a bad catastrophe. He decided to do something, and now the world is watching. So I'm extremely excited about introducing this very, very special guest, okay? So he is Dr. Adereni. He is the CEO and founder of HelpMum, okay? We're going to be talking about maternal and child health and how to reduce the rate at which it is in Nigeria. So stay tuned. I am going to play his video bio and bring him right up. Hang tight. Is a young social entrepreneur committed to improving maternal and infant health across Nigeria. He is the founder and CEO of HelpMum, a social enterprise that leverages the power of mobile technology and uses low-cost innovations to ensure first, the proper education and on-site learning of birth attendants. Second, the distribution of HelpMum's clean birth kits to pregnant women to help safe and healthy deliveries in rural, remote, and semi-urban areas. Finally, HelpMum's business model combining on-site and digital registration of new mothers and their infants to play a key role in increasing immunization penetration in Nigeria, especially in these remote or underserved communities. Dr. Adereni has won multiple awards across the world through his innovation addressing maternal and child health in Nigeria. Currently, he has a certificate in entrepreneurship management from Enterprise Development Center, Lagos Business School. His vision for the African continent is to see Africa for all Africans thrive, where committed leaders will help drive societal changes and sustainable economic growth and identify lasting and impactful solutions to improve poor healthcare and solve other endemic challenges through innovation and technology. Allow me to introduce to some and present to others Dr. Abiodun Adereni, founder and CEO of Help Moms. Hello, Doc. How are you this afternoon?
Yeah, I'm doing fine. How are you too?
Good, good, good. Thank you so much for joining us for out of your busy schedule.
Mm,
I'm just really I've been excited about this interview from just researching your website, looking at your bio, and just looking at various things that you've done. Again, thank you for all you do.
Thank you very much. Nice to have you.
Great having you too. So we're just going to go ahead and get started, okay? And guys, if you have any questions for Dr. Adireni as we have this conversation, please put it in the comment sections because we're going to be taking questions from the audience, okay? And if you like what you're listening to, please like and share so that it can get to more people. Again, thank you so much. So now, Doc, there are so many specialties in medicine. Why maternal and child health?
Yeah, so first of all, a disclaimer. I think a lot of people sometimes think I'm a medical doctor, whereas I'm not.
Okay,
Yeah, I'm not a medical doctor. I'm a veterinary medical doctor. Um,
okay.
but for my own passion, boiled down from the fact of when um, I was in 500 level and we did a course around toxoplasmosis, and one of the things I discovered was that when pregnant women keep animals around them, they are prone to having toxoplasmosis if the animal has toxoplasmosis, and that can lead to congenital infection for the child without being born. So, and I felt in my mind that even the women that have good knowledge, are properly educated, they don't know that sometimes when they keep animals around them, they are predisposing their unborn child to congenital infection. And for a woman that is in an urban area that doesn't know that, now look at it from an angle for a woman that stays in a rural community. She's not even going to know that at all because she's not even educated. So we decided to, me and some of my friends decided to go to some rural community to do some outreaches. Then we discovered that the problem was more broad. Like in this community, they didn't have an hospital. In this community, like women don't even know anywhere they can go to when they are pregnant. In this community, a lot of women they have children that they've not taken for immunization or taken for vaccines before. And that got me reading, and I found out that the problem we have in Nigeria is really broad in terms of maternal and infant mortality. At the moment I'm talking to you, Nigeria maternal mortality rate contributes to the world's maternal mortality rate by 34%. And in
What?
Nigeria, yeah, and Nigeria also, we lose sometimes as close to 2,300 under five children daily, under five children. So these deaths sometimes, the good thing here is that some of these deaths are very, very preventable, right? Preventable. So that's one of the reasons why I decided that if people can't just keep watching and say that the government has to come and solve this problem, we have to start from somewhere. Then I decided to take action. I decided to start first with the HelpMum Clean Birth Kit, and now we've gone into all other angles and all other areas of improving maternal and infant care with our vaccination tracking system, with our HelpMum Digital Health Cafe, with our HelpMum e-learning platform, and also digitally empowering community health workers. This All these things I've mentioned to you daily are now having impact in rural communities and are making more mothers have access to the best possible care, and it's also improving maternal and infant health in some of these communities that we've been able to introduce some of our solution and product.
So it was just from you being in school and seeing a
Yeah,
need.
yeah, yes, and then it.
Wow, that is really, really amazing. So, I mean, I understand this is more of a follow-up question. So I understand you took a class and then you saw a need. What made you just decide to just go all in? What what sparked that with saying, okay, I see a need, I'm gonna go all in, I'm gonna register a company, and then here you are,
Yeah,
how
what
did
made me
that
go
that
up?
transition?
So what made me went all in was that I saw that number one, I love children's, right? And as I am, I can't be in a place and I can just me hearing a child cry sometimes makes me very sad, right? Now hearing it, now you now knowing a mother that lose her child, it makes me like more in a very painful state. Then I saw that when we started, so first of all, when I was doing it as a partial thing in school, then I started seeing the impact and the success story coming out from it. Then we are just even doing only rural outreaches, and then people can know early enough whether they have diabetes. Some people can know whether their blood pressure is high so that they can take care of it before they go give birth to their baby. So I saw some of the early results, and I saw that if this problem can be tackled in a very innovative way, we will be able to save a lot of lives. So I decided to just go all in. I mean, I do the only thing I do now is help mom, and also I have another part. I have a part of the business also that caters for urban women. So I saw the need, but one of the things that I told myself when I was starting was that I will make sure we keep innovating every single time to solve this problem. So when we started, like I said, we started the rural outreaches. Now we moved to the Help Mom Clean Birth Kit. Then we moved to the Help Mom vaccination tracking system. Then we also moved to the Help Mom e-learning platform, and also digitally empowering community health workers by providing them digital tablets and the likes. Then we moved to renovating condemned maternity home to Help Mom Digital Health Cafe. And at the moment, we have Help Mom Research, where we are collecting data to build new AI technologies that can be used by government to improve immunization outcomes in their community, in their state, in their country, and also building also new predictive model that can be used to prevent maternal mortality enough early enough. So for me, I see it as a big problem that can be solved in an innovative way, and that's one of the reasons why I decided to stay at it and solve this problem innovatively, and also provide solutions that can actually affect the people that really need it, not just the people that want it, but the people that really need it, and we can see good result coming out from there.
That is extremely powerful. So based on your research, what was currently available before you now came in and decided to look at innovation? What was currently available to address these issues, or were they even being addressed?
See, when you look at maternal mortality, right, and infant mortality, there are a lot of reasons why we have high rate of maternal and infant mortality. I will tell you some of the reasons. Number
Okay.
one, in the rural community, sometimes they have only one primary healthcare center, right, in a local government. And this primary health center, sometimes they don't have cotton wool, or they don't even have injection, right? Sometimes this primary health center, they don't even have the hospital bed they have, they don't even change the what's the name, the bed sheet of it because
Are
there's
you
nobody.
serious?
Sometimes these primary health centers, they don't even have any doctor. So these are the kind of problem we face. So you don't expect the women that stay in this community or in this local government to have good health care. That's the first one. The second thing also is that there's huge knowledge gap around a lot of things. Number one, you ask a typical mother in a rural community that you have to take your child for immunization. They don't know the reason why. And you see a lot of reasons
Mm,
sometimes that if you don't take your child for immunization, your child might come down with a vaccine related disease and die through it. Something that could have been prevented if you are taking him or her for immunization. So there were people that were solving these problems, right? We had people who were providing kits to women. We had people before we came in, there was nobody that had a vaccination tracking system. We had the first vaccination tracking system first, but we had people that were solving this problem. But one of the things I realized is that most people were not solving this problem innovatively. People were just solving this problem as a project. So we decided that we don't want to solve this problem as a project. We want to make sure that we solve this problem innovatively and want to also be sustainable. So like I said, remember I told you about the clean birth kit. A lot of time when people see our pictures online giving out the clean birth kit, they think we give out the clean birth kit for free. No, what we do is very simple. We go to corporate, we go to organizations, we go to partners that also have the same value that we share, that are also passionate about maternal and infant health. Then some of them buy the kit from us in bulk, then we distribute it out for free. The other thing that we did was that we also saw that in this rural community, although these women don't have they lack access, that doesn't mean that some of them don't have the financial means to get some of these things. So one of the things we did was that we worked closely with the community leaders and the local leaders in this community, and they were able to identify women that can pay. Then these women also pay directly for our product. So it is more easier for continuity. It is more easier for us to continue to do what we do in a sustainable and a very innovative way. So one of the things that we brought on board was that people that were solving this problem, most of them were doing it as a project. Most of them was just in like this passing thing. Most people were not looking at the how long can I do this project? How far can I do this project? Most of them were just like, oh, maybe you now on your birthday, you just decide to go and give out kids to some women. Then that's it. Some people were just like, oh, I can do this twice a week or 3 times a month. We decided to take it as a proper enterprise and a
I
proper,
see.
yeah, to make sure that we solve this problem sustainably. So we have over 30 community health workers now selling our kits in rural communities. When they sell the kits, they also make commission from it, and we incentivize them. Like we make sure that they are also encouraged to tell the women that we know that you don't know about all these items you need to have delivery. This is the items. They are very cheap. It's just 2,500. Buy it, then you'll be able to have access to all the things you need, even though in your community there's no clinic or there's no primary health center. So that's one of the reasons why
Wow.
we decided that we need, and that's one of the reasons that also boiled down to what we launched last year, which is the HelpMum research. Currently, the HelpMum research now we have 4 papers. We
I
have four
see.
papers, and we also have a digital innovation we're about to launch where it's going to improve immunization outcome drastically. And it's not going to only
Mm,
be the context of that innovation is not only to Nigeria. It can also be used in Kenya, it can be used in Ghana, it can be used in South Africa, it can be used anywhere in the world. So this as if I was doing this as a passing project, I won't be in depth into it to think every day on how this problem can be solved innovatively.
wow. Amazing. And just that help mom research is very key. And I keep telling organizations like yours that are very you provide a lot of programmatic interventions. It's important for you to gather all that data and analyze it so that we can share with the public what is really going on from the ground, because that is a need Nigeria has, is data. We don't have data. So even the data that you're looking for that's national to even help you do your work is difficult to access. So that is a really good thing that you're doing. So our next question is, now, I know you've already talked about how you started. You get what I'm saying? And you started a social enterprise to make it happen. But give us the nitty gritty. When did you decide to make this a social enterprise? And look at how it's grown. I mean, all the awards and all that. And sometimes a lot of people like you do this for the passion, and then the awards come as a byproduct. But how did it get started from the beginning?
Yeah, so like I said, I told you we started in school, then I
Yeah.
was done with school. So
Mm-hmm.
when I was done with school, I told myself that if I go to serve, if I go for my service year, this is actually going to slow down me for progressing help mom. So I made a decision then not to go for my service year. That was the first thing I did. So I've not even gone for my service year up till now. Um,
Wow.
and I decided to start looking for opportunities because one of the things that became very clear to me was that we needed money to actually make things happen. But one of the also other thing I told myself was that for every 1 naira this company or this social enterprise get, we will be very frugal and make sure that problem are solved in a sustainable and a very innovative way. So I never forget that. That's still something that is on my mind even as I'm talking to you, as we keep innovating and doing everything that we do. So I will tell you a very funny story. So I saw this application online to come to Nairobi. Uh,
Mm-hmm.
but before then, when I was in my final year, I was invited to Nairobi by AMREF, where there was a competition which I won, and we got a little grant for that from that competition. So I saw this competition to come to Nairobi to come and spend 3 months in Nairobi and get $50,000 as an investment to scale your business. So it was very exciting to me. I applied. I was selected to come to Nairobi to spend 3 months in Nairobi. But when I got to Nairobi, that was in 2018,
Okay.
March 2018. I discovered that what they promised was different from what I was told when I was back in Nigeria. So at the end of the
Mm-hmm.
day, I spent 3 months in Nairobi, never got the investment, never got anything out of it. Then I came to Nigeria, like coming to start all over again. But I
I
never gave
see.
I never gave up. I knew that one thing was guaranteed, even with the little resources that we have, where I will continue to do things in a sustainable and a very innovative way. So then I included helping mothers, like people like you. There are a lot of mothers when they give birth, they decide to launch maybe a baby product or mother care product, but most of them don't have the distribution channel. So aside from help mom, then to keep help mom going, I started partnering with mothers like that. Maybe they are in Lagos or Abuja, so they send their product to Ibadan because we're based in Ibadan. Then we help them sell within Southwest. So we're making some money from that to actually help us sustain help mom. Then I continued. Then just like 6 months after, we got a very big funding from Google, $250,000. Then we decided to launch out as a proper business. Then we employed people. We have our own office. So at the moment now, we have our own office space. Since 4 years ago, 3 years, 4 years ago, we have our own office space. We have our warehouse. We have a team. We have our distribution channel, and we have everything. So for me, it was out of the because why I decided to tell you this story was that with all the challenges I've faced, I could have just decided to say, no, I'm not doing it again. Let me go
Yes.
back to myself. I mean, a lot of people felt, what are you doing? Like, go to your service. You're going to be paid well. You're here doing but I was very confident of the outcome, even though it was not clear to me then, even though I was disappointed in the process, even though I felt betrayed, I was very clear of the outcome that this is going to make sense and people will come on board, organization will come on board to see the value in what we do, and it will help us scale our solution and do amazing things. So between now and then, between 3 years ago and now, we've been able to scale to more than 15 states in Nigeria. Our
Wow.
tracking system now, our vaccination tracking system now has close to 70,000 nursing mothers registered on it, and they receive immunization. They receive immunization reminders and awareness to take their children for vaccine. And also our
Wow.
digital health cafe. Now we have over 2,000 community health workers spread across Southwest who have been trained by
Wow.
us and are also using our digital. We give out digital mobile tablet to some of them that they're also using it
Mm.
to save lives on the spot, to help more mothers have safe birth. We're beginning to see good results from the things that we do, because we've been able to see that even if low cost innovation can help save life if you solve it in a very, and I keep saying it all the time, in a very innovative and a very sustainable way.
Well done. So now that you've started privately now, have you been able to collaborate with the Nigerian government, and how is that? And if so, how is that coming?
Yeah, so we've been able to collaborate with the state government in Oyo State.
Okay.
We currently help the state government to help track immunization in the state. But because we Oyo State has over 1.2 million children, we can't do everything because of the resources that we have. Because
Mm-hmm.
the state government only gave us access; they didn't support us financially. Yeah, and
Okay.
I think that's how partnership with the government also goes most of
It
the time.
usually is, yeah.
Just give you the access there, but they don't support financially. So the Oyo state government, they've been I mean, we've tried other state government, they were not responsible. Oyo state government has been very responsive. Like the very first time we told them about it, they gave us the approval, and every year we renew the approval. So what we do with them is that they give us access to all the primary health centers in their state to track the immunization. So what we go is
Okay.
that we go to those primary health centers, get those data from them, register it on our vaccination tracking system. Then we track it from our office to ensure the mothers take their children for immunization. And that has been very awesome. We've been able to, in some of the communities that we've deployed our vaccination tracking system, we've been able to see increase in immunization outcome in all those communities, thanks to the
Okay.
Oyo State government that gave us those assets. So the partnership we have with Oyo State has it has started generating good results, and we've been able to see good outcome coming out of that. And in the next 2 years, we are looking at getting more partnership with more states, and also getting more partnership, and also getting the federal government to adopt the vaccination tracking system we've built, and even with the new AI system we just built to improve immunization outcome.
Okay. Okay. So for those, because I know on my platform I do have some government agency, some government employees and government people that work in agencies that follow my platform. So those of you who are there, please just know that working with civil society in partnership would only enhance impact. So thank you for that. So with our next question is, now you've you've come up with innovative ways to address the current issue of maternal and child health in Nigeria. What are your recommendations in order to improve the indices, the dismal indices that we have right now in Nigeria?
First of all, Nigeria has over 30,000 primary healthcare system. I can tell you that less than 10% of it is functional. First of all,
Stop
the
it.
government, yes, so first of all, the government needs to work to ensure that the primary healthcare system we have in Nigeria, at least more than 80% of them should be functional. And what they need to do first is this: they need to increase the budget for health care in Nigeria, and they need to increase the allocation that goes into primary health care board and the primary health care system to ensure that this primary health care facility are strengthened. Because the truth is this, in a urban community, we have access to all these big hospitals. We can decide to go to all these big places to have deliveries and the like. In rural communities, they are only boiled down. The only option they have is the primary healthcare system. So and most of the time when they go there, they are also always disappointed.
I
Most
see.
of these primary health centers are underdeveloped and not functional, and most of the time those women are now boiled. The only choice they have left is to have deliveries at their home. And when you have deliveries in your home, there can be complications. You can have
Yes.
hemorrhage before you get to the hospital. The mother has died, and these are the things that is causing a
Hmm.
high rate of maternal mortality. So we need the government, first of all, they need to revitalize the primary healthcare system we have in Nigeria and make them functional. The second thing is that they need to compensate the medical professionals well. Because one of the things I've seen is that most medical professionals, they don't like working in rural communities because they say, oh, they are not being compensated properly
I
and the
see.
like. So they need to start like enticing medical professionals to work in these communities, because if we have a functional doctor working in a primary healthcare system in a local government or in a rural community, it will help essentially reduce the rate of maternal mortality, because the women in those communities can visit this primary health center, talk to the doctor, they can be diagnosed properly, they can be treated properly, and this will help reduce the disease. And the other thing I want to talk about is the universal healthcare coverage. I think it's important that people actually have access to insurance. I mean, as a common man, most people, I know maybe some people on this call, most people don't have access to insurance, right? They don't have access to healthcare insurance. So I think that should be I think this is something the government should do to ensure that women in rural communities, to even ensure that families in rural communities have access to this, so that they don't have to pay out of pocket for healthcare services anymore, right? They should
Exactly.
make sure that there's a large sensitization in partnership with local leaders in these communities on the importance of healthcare insurance, and that should be easily and readily available to pregnant women, families that stay in rural communities. And that's also. And my last recommendation also is that the government need to work with local leaders,
Okay.
local partners, social enterprise, NGOs that are solving this problem. I mean, one of the things I've come to realize is that when the government work with you, government have access to more data, one, they have access to more resources. When they work with you, maybe let's say government work with HelpMum in the southwestern part of Nigeria. HelpMum can be able to do a lot of projects faster because government can provide resources and say, okay, every year give out maybe 100,000 clean birth kits to women in some
I
rural
see.
communities so that they can take it for delivery. Oh, every
Mm-hmm.
year do this on behalf. So government need to find local leaders, and not only even in maternal and infant healthcare, they need to also find local leaders in other healthcare sectors to ensure that healthcare can be improved in this country. And I know that if all these recommendations are made, if they are worked on, I'm very, very guaranteed and sure that the healthcare system we have in Nigeria will improve drastically.
Okay. Thank you. Thank you for those recommendations. Okay, so I'm going to ask you one more question and I'm going to revert to the audience. I see there are a few comments and questions in the comments, especially on the LinkedIn Live platform. So I'm going to go into the so again, if you have any comments, if you have any questions for Dr. Adereni, please make sure you put it in the comment section, okay? So that we can address it after he answers this very question, okay? All right, so our next question is, and if you like what you're hearing, please like and share, like and share. Thank you so much. Next question is this. How can an expectant mother and a new mom reach HelpMum for its services?
How can an expected and reach help for his services? So I think that's a very good question. Like I said, you know, one of the things we did was that to partner with local leaders, to partner with
Okay,
community health workers, because they have more close proximity to women and pregnant women. So most of our product and services can be gotten through them. So let me give you an instant now. The community health workers, they help us sell our clean bed kits. And
okay,
also, when we want to give out free clean bed kits that are being sponsored by organizations, they are the one that help us get the women. So we use the community health workers is one of the ways we use to get across to to our target audience,
I
which is
see.
pregnant women and nursing mothers in rural communities. So we use them. The second thing also is that we have a physical office. You can people walk in sometimes. We've seen women walking into our office at Akobo to buy our product, to buy
Okay,
our what's the name, to get all of the things that we do. And also, like I said, our vaccination tracking system also can be people have access to our vaccination tracking system also through these community health workers,
I
because they are the
see.
local leaders. We've identified them as local leaders that we can work with in rural communities, because they are the ones that ensure that our services, our product, they reach out, they get to the last mile audience that we are trying to get across to. We also
Okay,
personally also reach out to our last mile audience directly, but most of the time, 70% of the time, we use the community health workers that we closely work to, and we have over 2,000 of them to reach out to our last mile audience, which are the pregnant women. Why am I saying community health workers? Community health workers are local leaders in rural communities because women listen to them and they have access to a lot of them. A
okay,
community health worker can also help you identify women that need the service you are trying to provide for them at most. Let me give you an instant now. Like I said, some women can buy our kits because they have the money. Why
Mm-hmm.
some don't have it? One of the things we do is that when we want to give out free clean birth kit, the community leaders,
Mm-hmm.
which is community health
Mm-hmm.
workers, are the ones that help us identify women that actually need these services. So, I
Mm-hmm.
mean, we use them, and also we directly reach out to our what's in our end users, and also women can come to our office also to get some of our
Okay.
product and services.
Okay, okay, great. So I'm going to go into the audience. I have a few comments and I have a few questions for you, okay? So here is from Charles Chibuisi Ehiemere. He says one of the contributing factors to health challenges and healthcare systems in Nigeria is HRH. How does your package ensure that the health clinic have the required HRH to serve the population within their locality? So, Charles, you have to let us know what an HRH is, or if you know what that is, Doc.
I'm confused what it means by
Yeah,
HRH
yeah. That's okay.
because
So
this
I
can mean
think
a lot of.
yeah. So let me ask. Let me just go to the next question. I think it's from our same user. He says, "How do you deploy the digital solutions? How technologically savvy is the healthcare workers? What is the prospect of social enterprise for health intervention across the rural areas and hard to reach areas?"
Yeah, I
So
like
that's
this
a more
question.
complicated question. Yeah.
I like this question very much. Most he's very right. Like
Mm,
most community health workers are not tech savvy. One of the things we
mm,
did, so if you go to our website and you go under
mm,
e-learning, let me use our e-learning platform for an
mm,
instance. We
mm.
have our e-learning platform on our website. So you can go to
Okay.
our website, access our e-learning platform there, watch all the videos, even as a healthcare workers. But we know that 80% of them are not tech savvy. So one of the things we did was that we got digital mobile tablet
I see.
in partnership. We did one in partnership. There was one we had a partnership with Facebook. We got some mobile tablet. Then we reinstalled all the content of our e-learning platform on the mobile tablet. So you don't need internet or anything to access it. You can just use the mobile tablet we gave to you to watch it all over and over and over again to save the life of a mother, right? Because and we one of the things we do is that before we give them that mobile tablet, we call them together. If we are renting now, we call the 20 people together, the 20 women together, and we train them on how they can use the mobile tablet. And we have a very strong evaluation team. This
Okay.
monitor and evaluation team is that they constantly reach out to these women to ask them questions. Are you having any challenges with the mobile tablet? Is there anything you don't understand? Anything they don't understand, they provide help to them. But one of the things they come to realize is that they use those technology very well because number one, they don't need internet subscription. They don't need anything. All the content they need to have access to is on the mobile tablet. And also, we encourage them that they can also give those content to other women in the community, other community health workers that they know that have a maybe smartphone and they know how to use the smartphone. They can always use Bluetooth to send those content to them, and those content can be used. And those community health workers can use those content also to save the lives of pregnant women and nursing mothers in their community. For our vaccination tracking system, we also install it on on all those mobile tablets also, so they can use the vaccination tracking system. So our vaccination tracking system is even on Google Play and Apple Store. So we just install
Okay.
it on those mobile tablet, and those mobile tablet can be used. Those the vaccination tracking system, you can use it to register mothers as well as they want. And some of
Okay.
them they don't know how to register on the vaccination tracking system. So what we do is that we give them a sheet, they can write it down, they can snap it to us, and there's a team in our office that is in charge of helping them to register. Those are for some of the people that don't know how to register mothers on our vaccination tracking system. So one of the things I've come to realize is that when people are not tech savvy, you teach them. You teach them. And also when you create solution, don't create solution that requires internet connection because most of the time in all these hard to reach communities there's no internet connection. So make sure you create solutions that is kind of devoid of internet.
Okay. Okay. Looks like there's a bit of an issue with the internet connection. He was just talking about internet connection, and then all of a sudden, we're having issues with the internet connection here. So I think let me just see if we can if we can get him on as soon as possible. Just a second. Okay. So I think he'll join us shortly. So again, if you have any other questions for Dr. Adereni, just let us know. It looks like there's an issue with the network at the moment, but most times when you want to come up with a tech solution in hard to reach areas like rural areas, you better not have the internet because there would be issues with accessibility at the moment. And even the percentage of internet penetration in Nigeria is still quite low, though those of us who have access sometimes take it for granted. But we actually, the internet connection, the internet penetration in Nigeria is still quite low. So I think he will be on shortly. But while we're waiting for him to be on, just hang tight. As you know, okay, there he is. There he is. There he is.
Sorry, I
All
think
right, Doc.
yeah, yeah. I think internet, yeah, was
Yeah, you were talking about the internet connectivity, and it was like I think we jinxed it. so 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 you were saying that where you stopped was that if you're going to come up with an innovation in hard to reach areas, that you should do it without the internet in mind. That was where
yeah,
you.
yeah, yeah, yeah. You should solve it without the internet. If
Mm,
you know that you have to give out a mobile tablet, install the content of those mobile tablet on the install the content on those mobile tablets and ensure that the beneficiaries can use it without the internet. So that's one of the things that we did to crack that part of our project.
okay, okay. So I know you were talking in our last in doing the Q&A on an AI system you have coming up. So I have a question from Adiola Akintola on how does this AI system work?
The AI system essentially is that on our vaccination tracking system, we saw a lot of challenges on why women don't take their children for immunization. A lot of challenges. So one of the things we did was that we partnered with Google. We were selected for the Google AI for Social Good project. We were the only team selected in Nigeria. So we partnered with Google and we've partnered with a research scientist from Vanderbilt. Then we are now creating those an AI system that can identify a reason. So for you now, the AI system, if you put your details, it will be able to identify a reason why you won't present your child for immunization. Then it will provide an intervention that we should give you, right? So that's the AI system we are currently working on, and we should have it. Everything being equal, we should have it launched before the end of the year, and we should have it deployed in some communities in Oyo State. So that's our goal for the AI system we are working on at the moment.
Okay. So I think what Charles was saying was talking about human resources for health. In terms of his last question when he talked
Okay.
about HRH. So
Okay.
I think so we can revisit that question. He said one of the contributing factors to health challenge and health systems in Nigeria is human resources for health. How does your package ensure that the health clinic has the required personnel to serve their population? And I think you mentioned it earlier in terms of the human resources in these healthcare facilities, but
Yeah.
that they're not enough. But is there
Yeah.
anything
Yeah.
you want to add?
So for us, our package essentially helps more mothers to have safe birth, even irrespective of the kind of human resources they have within their locality. You
Okay.
understand? So typically, when you are pregnant and you're about to give birth, you're meant to go to an hospital. A doctor is meant to attend to you, right? And the doctor will help you in the process. You have your child. But in some communities, like I said, there's no doctor, the primary health care center is not functional properly. So one of the things we do is that we keep them the clean bed kits, because most of them will have to use their home to have the delivery. Then when they use their home to have the delivery, they have people called community health workers or traditional birth attendants. Those traditional birth attendants also, we've trained a lot of them, and
I
we've provided them
see.
digital health. We've digitally empowered them by providing them with a mobile tablet or the content of our e-learning platform. So they use those content also with the clean birth kit we've given to the women to help them have a safe and hygienic delivery. So that's one of the things our own solution is solving, is in terms of HRH. Even though the community is under resourced, the healthcare system is not functional, we've created solutions and innovations that can still help the women have the same kind of experience, assuming they have everything that is required in their healthcare facility, and they have a doctor in their healthcare facility. So look at it this way: the experience a mother will have, it might not be the same if she's having the delivery in her home. But remember that HelpMum has digitally empowered the community health worker that is helping her to have that delivery. One, two, HelpMum has provided the package and the content that she needs to have that delivery in her home. So she's going to also have the not might not be like the total experience a mother that's typically using an hospital in an urban community we have. So there's no difference. At the end of the day, both parties, they are going to have a safe birth. Both parties, they are going to have a safe delivery, and at the end of the day, both parties will be all okay and fine.
Okay. Let me just there's a comment from here concerning still about HRH. I think he said that I think the issue is the lack of motivation and support for healthcare workers to seek rural practice, which is what you alluded to. The problems were usually a lack of basic amenities and working conditions. But what has even escalated it is the growing insecurity. Apart from the workers, if well encouraged, private mega health providers, which is mega private hospitals, can invest in rural areas to scale up whatever government has been able to do or is doing. So I think it's kind of some what you also alluded to with not having the basic amenities and again
Yeah,
pay
and they're not
salaries
properly.
as
Yeah,
well.
yeah, and also, I also agree with some of the things they said, like about the insecurity issues.
Mm,
I know a lot of doctors now, they don't even want to go to any rural community in the north,
mm,
right? They
mm,
say that they don't want to go there at all, right?
mm,
Even in the southwest, in the southeast, a lot of them don't even want to go because they believe they are being underpaid. So that's one of the reasons why I said that
mm,
the government have to look into that to make sure that their compensation is good, and to
mm,
make sure that they provide them the required maybe security that will
mm.
encourage some of them to work in some of these rural communities and in some of these rural hospitals. That's one of the recommendations I gave.
Okay. And then here, I think he also talked about the health insurance bit. And I think there's a comment here. This says, as much as I agree with Dr. Abiodun on the intervention of government in the aspect of health insurance for the non-formal sector, it will be very difficult to achieve that without a full commitment for government to do with regards to conducting a proper census, biometric recommended, and government commitment to birth control programs. So that was the comment concerning some
Yeah,
of the
yeah, I agree. I agree.
recommendations
I
earlier.
agree. Like I said, all these things are intertwined, right? They're intertwined.
Mm,
But the first step is the government to take action first in these regards, right? They are intertwined. I'm not expecting the government to achieve this, like when they start the health insurance for the non-formal
mm,
sector.
mm,
I'm not expecting them to do that in massive scale, but I believe that they can be able to maybe start out with maybe two states in the southwest, two states in the north central, two states in the northwest, two states in the northeast, two states in the north south, two states in the southeast.
Southeast.
You understand? When they do that, they can be able to take learnings. Maybe they do that for a year. They will take learnings to keep improving on the process until you have a perfect process. He mentioned two things. When they do that, they might even see like more things they need to do to encourage people that will even make the healthcare insurance more effective. So I believe that the starting point is for the government is to first start, and they can do a pilot like two states in the in each of the geopolitical regions that we have, then they take the learnings, they keep improving. Like, and maybe after 5 years, they have the perfect system to help make sure that all population in the informal sector have insurance. Yeah, okay,
Okay. Thank you so much for addressing a lot of the questions and the comments from our audience. So we're just going to go into your final thoughts, Dr. Adereni.
Yeah, so my final thought essentially is that I think for maternal health, we need to. I think this should be a collaborative effort. And I also feel one of the things I didn't mention as a recommendation that I forgot was I think the government also need to invest in research. I mean, because when you invest in research, you'll be able to come up with new innovations, new solutions that can help solve the problems that I have in terms of maternal health in Nigeria in a more innovative way. So I think the government needs to come up, do more in terms of research, invest in research. There can be a maternal and infant health institute of research that can be established by the government, in which they bring together local leaders, they bring together innovators, they bring together techies, they bring together AI experts to look at some of the problems we have in Africa, in Nigeria, in terms of maternal health, and see some of them that can be solved using data, and you see some of them that can be solved using artificial intelligence. So I think the government should also look at that. They can launch that, and I also feel that, like I said, solving the issue of maternal and infant health is a collaborative effort. It's not only led for maybe HelpMum, Mobicure, or any organization solving this problem to solve it alone. I think everybody should come in to join. Everybody can be involved in one way or the other. And I also think the media also can help project the stories of some of the good impact so that it can also encourage people to also come and join on board. So thank you very much for having me. This was a very awesome conversation, and thank you.
Thank you so much, Dr. Adereni. This is not going to be our last conversation because you are using innovation to change the world. Again, thank you so much for being here.
Thank you very much.
All right, take care.
Take care.
All right, thank you so much for watching the Development Sector Series, which is Dev Sector Series. Our guest, Dr. Abiodun Adereni, the CEO of HelpMum, and it's just giving us a confirmation that when you stay persistent in what you're doing, you end up, being on the other side with the successes of his program. So again, that was such a great program. So again, thank you so much for watching. Again, Untold Impact is coming really soon. I am just going to share one of the snippets of our interviews with one of our very special guests, Aisha Yusufu. So thank you again so much, and let us change the world together. So I'm just going to play a snippet, and I'll see you again next week, Wednesday at 12 noon. Take care.
So on my 40th birthday, just thinking, and I realized that I had become that adult that I used to blame, and that there are children, also teenagers in my position, who are also currently at that time in the position that I used to be. And that was eight years, about 8 years ago. I turned 40 on the 12th of December 2013. And so on that day, I said to myself, I will start speaking on Nigerian issue. I will no longer be a passive citizen. I'm going to be an active citizen. And also, I could make that decision because I had gotten to a point a place where I was financially independent. You know, in Nigeria, if you're poor, you're faceless, nameless, and voiceless. You're seen as a nobody. I grew up poor, where you were not even seen as a human being. People didn't want to relate with you. People didn't want their children to relate with you because you came from the wrong side of the town, and they felt that, oh, you probably are going to corrupt their children. That's the way I've been able to rationalize it as an adult. But as a young child, I didn't understand what that was all about. So I was very focused on that financial independence. And so I got that before my 40th birthday. And I made that decision, and I said to myself, if God gives me another 40 years, I'm going to devote it to Nigeria. And 4 months later, Chibok girls were abducted.